Uh,
Good morning everyone. So here we are going to have a discussion regarding the support vector mission. So can anyone tell what method or what activity we can go for this topic?
Imagine a doctor diagnosing a patient. There are two patients have a similar show the similar symptoms. The one has a serious disease and the other one doesn't. How do you make the right decision?
Okay. So here we have two categories. That is, the two patients have the both symptoms, but they don't have the same disease, right? So we can make it as one patient where just have a viral fever, where other patient may have one of the symptoms of heart disease. So we can take the support vector machine algorithm. So what is this SVM stands for is support vector machine, which comes under our supervised learning in AIML. So in supervised learning, we are going to segregate the data. So as you said, I am going to take a data set where I have fever. So I have patients with fever and few patients with nausea problem also. So I may take a few patients with nausea problems also. Here I have to look for whether the patient has both the symptoms or patient has only one symptom similar in between them. If I am taking only the fever, if both the patients have only fever and sense, I may consider it as the patient has only a viral fever, where excluding from the fever, the symptoms may increase. May they have nausea problem, they may be vomiting, they may be having the hand pain, chest pain. So I have to go on to the next data set also. So what I am going to consider is, I may have n number of data sets with me. I am going to compare, I am going to segregate, I am going to compare it. So for us, as of now, for my analyze purpose, I have the previous data set here. I am going to throw the linear data line. So in the previous methods, you may have a spherical method of grouping, that is clustering. Here I am going to use a hyperplane to segregate the data. This straight line is called a hyperplane. So first concept in my SVM is hyperplane, which acts as my boundary to separate the data. So next one is support vectors. So now I have the hyperplane. I may be having data sets randomly splitted here. I am going to cluster it depending upon the support vectors. So these data sets are called my support vectors, which decides my boundary. So I may use n number of boundaries until I get the optimal solution for my concept. So I am given with the data set. I am going to separate with an hyperplane, which is called a boundary. For separating this boundary, I am having the support vectors, right? So here I'm going to have one major concept, which is called as margin. So this margin is again splitted into two data sets, that is soft margin and second one is your hard margin. So can you guess what is soft margin or what is hard margin? Okay, let me tell you that. I'm having the boundary line, and this boundary line may have misclassifications. So kindly look into that. I'm having the boundary line. Here both the data sets are equally splitted, but here I have both n and f also, here I have both n and f also. So this n should be replaced here. So the separation is not proper classification, it has some misclassifications. So my soft margin allows some misclassifications to separate the data, whereas my hard margin does not allow any misclassification. The boundary line is given until optimal pure classification is done. Pure classification in sense there is no misclassifications. Both the data should be separated individually. So here I may consider it for heart disease, or I may consider it for diabetic patients. Similar symptoms may reflect one person to another, but one person may have diabetic, another person may not have the diabetic. So we can go for any number of disease with the data sets which I have here. Okay, so can you give some of any examples for this medical diagnosis? I have given you diabetic and heart disease. So any other examples?
SVM is widely used in face recognition, spam detection and medical diagnosis.
Yes, apart from the medical diagnosis, they are used in facial and pattern recognition. So can you tell me what are the advantages? So now you have the applications. Now the application we have discussed. Can you get a brainstorm of what will be the advantage of this algorithm?
Ma'am, the advantages maybe it is used in high dimensional data sets, ma'am,
Yes.
where they are very accuracy, ma'am. Even though the small and medium sets can be used, and the data sets are very scandal, ma'am.
Yes. So here we can taken only for fever and nausea. This is a very basic symptom, but this is a small data set. But from small data set to large number of data set, we can apply this algorithm. And for that applying the algorithm, we have an option of kernel function. This kernel function helps me to transfer my 2D data into high dimensional data. So I can convert this data into high dimension. I can go for better analyze purpose also. So that is a very good advantage of this support vector machine. So can you analyze any limitations regarding this algorithm? Yes.
Not suitable for a large data sets, ma'am.
Okay.
Sensitive to noise, ma'am.
Very good. So here I can also find some noise as this n may be considered for your support vector machine. Whereas if I'm having n here, whatever the hyperplane I am going to implement, this n will not come to this side, right? So that type of data is called as your noise, and that noise data sets you can go for the perfect classifications. So that will be your limitations, right? So this is your support vector machines algorithms, basic concepts and basic principles. And I think now you are clear about the classifications done with the help of support vector machines. In the next, we will discuss about the other algorithms also. Thank you.
Thank you.